Hello, everyone. I'm Lynn Cremando with YogaUOnline, and I'm here today with Rachel Krentzman. Rachel is a PT, a yoga therapist, an experienced yoga teacher, and a Hakomi psychotherapist. She's the author of 2 books related to the care and feeding of a healthy spine, Yoga for a Happy Back, a teacher's guide to spinal health through yoga therapy, and Scoliosis Yoga Therapy and the Art of Letting Go. A graduate of McGill University and literally thousands of hours of yoga studies, Rachel's been incorporating yoga into her PT practice for more than 20 years. She's a co-founder of the first International Association of Yoga Therapy accredited yoga therapist training program. She's also served on the accreditation board of the IAYT rather. And she's passionate about integrating yoga into the healthcare system. She offers online trainings, and as we see, because she's in a hotel room right now doing one, in-person trainings all over the world on yoga for spinal health and scoliosis for the general public, for yoga teachers, for healthcare practitioners, and the like. So welcome, Rachel, and thank you for taking time out of your workshop that you're doing for us. I want to talk to you about 2 somewhat recent and related trends. The first is the graying of the population, which is worldwide. And we know that, in a year or 2, there are going to be more 85-year-olds than 5-year-olds. And it's a trend that is looking to go deep into the future. The second is the first time people coming into yoga for the first time being part of that population. That is the largest demographic coming into yoga for the first time, the graying population. So we could call them the over 60 crowd. And of course, at YogaU, we're all about longevity and healthy aging. And we know that 60 is the new 20 and 70 is the new 40 and all of that stuff. But in fact, many of the people coming into yoga are not the 60, the new 20. They're kind of deconditioned and they've been advised to do yoga, but some of them are coming in because they have issues. And one of the biggest issues is low back pain, which is one of your trademark things you've spent many, many hours and years working on. But that doesn't mean we can say anything about what's going on. So can you talk a little bit in general about whether low back pain is a reality and a necessity and a given, or whether we can age in different ways? I'm going to ask you more specific questions, but just in general, can you just talk about how those things are coming together?
Absolutely. The truth is, I started with a back injury when I was young. When I was in my 30s, early 30s, I actually had a scoliosis when I was 16. And I herniated a disc in my spine in my 30s during yoga, while I was practicing yoga, while I was already a teacher. So my experience was really, as a younger woman, feeling healthy, active, doing all these things, and still, herniating a disc and suffering numbness, tingling, weakness in my leg. So I felt that, I suffered from this back injury, not at an older age, when I was that kind of very active and young. And then I started looking around, and there were a lot of my colleagues and a lot of my friends at that age who were also struggling with back pain. And the more I started to investigate, the more I started to notice that the age that people tend to start having back pain is much younger. It's actually not in the late 60s and 80s or 70s. Often people who have back pain are between 30 and 55, and started to explore the impact of stress on back pain. And as I started reading books, started to look at the research, you can see that as people actually age, the incidence of low back pain is less, even though they have more degeneration and
Mhm.
osteoporosis and more changes on their MRI or X-ray. And this is a known fact. If you look at the research, the back pain peaks between the ages of like 35, 55, 60. But after that, it sort of starts to go down. That's not to say that people don't have pain when they're older. They do, but a lot of the back pain that happens mid-age is related a lot to stress or overdoing. So it's a combination. And the back pain that comes as we get older tends to be a little more related to degenerative disc disease, to
Exactly.
osteoporosis, to less space. But the incidence is even less as we age because our stress levels decrease. We have more freedom. Um, we're not in the middle of raising children and careers. Things are winding down at that point. So I believe back pain is really present for everyone. Now the population is aging, it's true. And so what we're trying to do is find ways to to be healthier, to not experience as much pain, even though there's some degeneration, which is a given. It's just part of aging. But actually, the research shows that degeneration and all of those things related to aging is not a predictor for back pain,
Right.
even though a lot of people feel that way. And so what I'd like to propose is that if we really work intelligently with the body
Mm.
and understand our body, understand what we need for our posture, the way our spine is, that we can live a long, healthy life, even with degeneration, even with arthritis, even with stenosis, all the things that happen as you age. You can still have a very happy, pain-free life. You just have to be smarter. I think you have to be smarter as you get older.
I think you're reminding me of something I hear my physical therapist friends say all the time, which is the pain is not where the problem is necessarily.
Absolutely.
I
I
think what
agree.
you're saying is the research is showing that to be true as well. And I'm also reminded of the work, I guess maybe we could say from Dr. John Sarno when he was discovering that when they started MRIing everybody had disc issues, but not everyone had pain. Not everyone knew they had disc issues. So uh, how does an aging back, so someone who's had the pain profile and it's stress related from 25 to say 55, how does that spine age? There must be different outcomes
Mm,
possible.
yeah, I think a lot of the stress in the beginning when people have back pain is real, what happens with stress is a lot of the muscles become very tight, very tense, and impact they go into spasm and create compression. As we age, it becomes a little bit different. Maybe the stress level is not as high or the muscles are not as tight, but there's actually less space between the vertebrae. There's less space. The discs thin out. There's less space where the nerves exit throughout the spine. So there is more chance of compression. And so basically, when we have pain, it's because of compression, because something is being pinched, whether it's a nerve or the joints are touching each other, or there's a wear and tear of cartilage. So the joints are touching each other, and that causes the nerve endings to fire and then inflammation to occur. So probably in the aging population, it's more related to a lack of space and more compression. And in the earlier age, it's probably more that the muscles are tight, causing the compression. Either way, the pain, I believe, in the back is a very vulnerable area because all of our pressure, all of the weight that we carry goes to the lumbar spine, especially the low back. Now, actually, there's a lot in the neck as well because people are looking down at phones and on computers. So there's a lot more neck issues as well related to arthritis or degenerative disc disease. But these are just areas that are where the weight falls. So they're the most vulnerable areas. But what we want to look at is And so there may be nothing necessarily wrong with your back, or you might have on MRI or X-ray some degeneration, but that's not the cause of the pain. It's just where all
Right.
the pressure goes to. So what I like to do is really look at the whole person, to kind of back up, zoom out, look at how am I moving, how am I standing, how am I, using my body that's contributing to more compression in the low back, and how can we decompress? So for example, a simple thing is very often we're very tight in our upper back. Our thoracic spine is tight, so people are sitting at desks, they're rounded. Because the upper back is tight, all the movement occurs at the lumbar, and then that gets very weak and worn out, and that's where the pain comes. But the problem is not the low back. The problem is that I'm not mobile in my upper back. So if we work on that, it will take the pressure off the low back indirectly. So I think a lot of people focus on the fact that their spine is a problem. And I'd like to argue that it's not, that it's just doing its job, but just all the weight goes there. So if we can figure out a way to bear weight more efficiently throughout the whole skeleton, which is really just coming back to nature, it's just coming back to finding our balance in our spine so that we bear weight equally through all the vertebrae and not just in the low back.
You're really speaking about a topic that is really near and dear to our hearts at YogaU, which is posture and your vertical, I call it your vertical body, but keeping your vertical body vertical. So everybody can do their dharma. Everyone can do their jobs. The bones do their jobs. The muscles do their jobs. The fascia does its job. They're not subcontracting work out.
Absolutely. I love that. I like that. I've never heard that before. Subcontracting. Okay. No, but it's true. There are certain muscles, like little muscles in the neck, for example, that are not meant to be working all the time, right? That's not their job. Their job is to kick in when you need to turn your head or do a few movements, but they shouldn't be completely on when you're standing or sitting. They should be quiet. So if a muscle is small and its job is not to be activated all the time, and then all of a sudden you're using it because your head is forward and you need to hold your head up, well, then of course the muscles are going to be tense and sore.
Yeah. So we talk about fluid balance a lot because we're big on myofascial issues. And I know that one of the things that happens when you're losing space is you're also losing either the volume of fluid or even just the distribution of fluid to joints where that need to be bathed. Can you talk a little bit about how we nourish our spines through fluidity, if I'm correct about that? But
Yes, I think I teach this in my trainings very often, but movement is the key, to be honest. When we don't move efficiently throughout all the levels of the spine, and this is meaning throughout, more of a congruency throughout the spine. If we're not moving at certain levels, the levels that are stuck or stiff or less mobile, those are the ones that tend to dry out, become less fluid. And the minute we have a drying of the tissues, which comes from a lack of movement, because the movement, pushes fluid, pushes the disc material into different areas. The minute we lose that movement, we start to dry up in that area. And the minute we start to dry up, things start to crack. And as soon as there's a little bit of a crack because of the dryness, then the disc material sort of seeps out into the crack. So the key to really nourishing and creating a more fluid spine is movement, but intelligent movement, which means you have to stop and become aware and pay attention. Because if I'm, for example, twisting in a yoga pose and I always twist in my low back, but I never again twist in my upper back, which is very common in a lot of people, then the low back is taking too much of the pressure. The upper back is not moving at all. And you can end up with an injury or, hurting the disc. But again, if we're able to know that about ourselves and then start to change and we create length and we start to move in places where we're not moving normally, that's the key to maintaining the fluidity throughout the body.
So am I correct, or I'm just going to ask you, so you're that person who was stressed out in your younger years and you're coming into your older years, which a lot of people are, and you didn't necessarily take care of the stress, are you now looking at the more structural stuff happening? So in other words, the earlier you start moving, the better. And do you see where I'm going? Is it a given if you don't take care of your movement issues and your back pain when you're 45, things are not going to look any better when you're 65, because now you've moved into the place where you've got structural, you've got degeneration.
I see what you're saying.
Yeah.
Yeah, well, I don't like to think of it that way necessarily. Like, I always like to think that at any stage and at any age, honestly, I think you can make a difference. And so, it is obviously, better to find this awareness practice to be moving, to stay, to stay mobile, to be engaged in intelligent movement from a younger age. But it's not necessary, because I've often, see people coming in their 70s who've never done it before.
Mhm.
And I really believe at any age you can make a difference, because the body's adaptable. That's the beautiful thing at every age. And so even with the structural change, and by the way, even if you start moving young, it doesn't mean you're not going to have structural changes as you get older. So, sometimes there are genetic factors, and, there's other factors that happen, and people who don't do a lot of movement are okay, and people who do a lot of movement are not. So I don't think it's, I always think it's good to be engaged and intelligent in your movement, but I also feel that at any age where you come to it, it will make a
Yeah.
difference and it will help, and that you can rebuild. It is harder to rebuild certain structural changes once you get older, and that's why we want to start as soon as possible.
Mhm.
But at any age, we can start to build, to create more mobility. We can start to rebuild the curve. But you have to be consistent. I think
Yeah.
that's the key. Consistency is the key at any age.
I think you've hit on also something that's kind of important, because you have spent a lot of time bringing together a licensed therapeutic practice with a
Mm-hmm.
more uh, a yogic. So you put East and West together. And one thing that happens when a really well-intended doctor says to their patient of any age, you should go do yoga. I don't know that they always have it in their head what kind of yoga, where they're sending the person. And there's a lot of people who step into a class with 35 people. And I always say it this way: it's a 37-year-old and a 73-year-old standing next to each other, and they're getting the same class.
Yeah.
What if I'm someone who's concerned about my spine health?
Mm-hmm.
First of all, what can I do in a yoga practice? What makes a yoga practice a really good way to avoid your physical therapy to keep my spine healthy? What is it about yoga that we can do for the spine throughout our lives that will be nourishing and encouraging of just a long and healthy spinal life?
So I think it's important that the type of yoga, because not every style of yoga was designed for aging bodies. Some were designed for younger kids in India, like an Ashtanga practice, for example, or a strong vinyasa practice. So I think if you're really approaching your yoga practice as a way towards longevity and health and well-being, and especially as we age, then we do need to slow down a bit and pay more attention. So it needs to be a practice that's very mindfulness-based, very awareness-based. I do believe that the teacher needs to be able to see the students and correct them. And, you want to go to a class where someone is watching you and paying attention and giving you feedback. Because one of the biggest pieces of healing through yoga is that the teacher becomes kind of this mirror of, oh, you're doing this, you're collapsing here, or you're not moving from this part, and brings a new awareness to the movement. It doesn't help to just go through the same movements over and over again. So regardless of the style, without getting into too many different styles, although I definitely lean towards a more alignment-based approach, is really making sure that you have a teacher who sees you and corrects you. So not being in a huge gym with 40 people, and it's not a fitness program. That's not how I approach my yoga practice. Um, that it's really about awareness, mindfulness, well-being, relaxation, understanding how to move with more intelligence. So any style that does that, I believe, will create change, because there's so much intelligence in many different styles of yoga. But you do have to slow down. You do have to pay attention, and you need to have someone reflecting on you what you're not doing correctly, so that you learn how to move differently.
Which means as a yoga teacher, it is incumbent on us as yoga teachers to learn and to know what we're talking about when we're looking at people's spines, or when we're looking at them doing a twist and making sure they're twisting on the axis of their spine and not collapse,
Mhm.
just
Yeah,
grinding away.
I think the responsibility is both. I think the teacher has a huge responsibility. And I also think the client has a responsibility not to push themselves if the teacher is not paying attention or they're in a big class, to notice if they tend to push, because the teacher can't, always see everyone, especially if it's a little bit of a larger group.
Mhm.
But for me, that's sort of my specialty, is that I feel like after many, many years of seeing bodies, even if I have a room full of 20 people, what I try to do is I never practice with my students. I might demonstrate, but I never practice with the students, which is a big deal, because then I'm not looking at the students and then I'm not teaching. You know,
Right,
a teacher is not showing that they know how to do the poses. A teacher needs to teach.
right.
We demonstrate, but then I'm looking around and I'll always point out the few people who I feel are doing within the pose, maybe a little harm. You want to make sure that they're not hurting themselves, and that they're getting the benefit of the pose. I use props. I have to say, I love props. Not everyone loves props,
Love
but I love
props.
props and straps and chairs. Chairs is my new favorite prop of all. And what they do is they just allow you to get the benefit of the pose, because if your spine is not in the right alignment, then you lose the pose, you lose the flow of energy, you lose the alignment, you lose the opening. And it's all ego, I think, that stops us from wanting to use props, but I'm a big fan of props.
I'm a huge fan of props as well. And we have a lot of teacher trainings that we do. And I always tell people to sell the benefit of the prop. Don't treat it like this is your modification if you can't do the pose, because that feels like I'm being sent to the children's table. You know,
Exactly.
I'm not able to eat with the big kids. And you can do so much more to move the floor or support both sides of your body if you are propping. And I think that the way teachers present them, if they present the prop as a bonus, hey, we're going to learn a better way to do this pose today, we're going to use a prop, rather than if you can't do the pose, try this.
Exactly. That's what I do. I basically have everyone take a chair. I don't say
Exactly.
use a chair because you're the one who has tight hamstrings and you can't do it.
Uh,
I'm like, no, we're all taking chairs. We're all going to do it with the chair, and let's feel it. And then maybe we take it down and say, now, does it feel like you have the same alignment? Does it feel like you're compromising? And if so, let's go back to the prop. Because if you don't give people a choice and everyone's doing it, then it doesn't feel less than.
Exactly.
Mhm.
Well, you have great ideas about teaching and incorporating therapeutic ideas into what we call wellness practice. So, a lot of people, I'm a yoga therapist also, but I teach many more people who are in a group class who need a little bit of help with wellness than I teach people who have already gone into the direction of, I'm in trouble, can you help me get out?
Mhm.
Um, in that kind of an environment, you are teaching a class for us on preventing degenerative disc disease, not just for teachers, but for anyone, how anyone can foster healthy mobility and nourish their spine. And I'm thinking through their life by the way you've been talking, but will you speak a little bit about your course.
Yes, so I was asked to do this course for YogaUOnline, and I'm very excited about it. It really kind of helped me narrow the focus on degenerative disc disease and just maintaining a healthy spine. And luckily, I studied with a wonderful teacher. Adil Pokivala is my teacher and a longtime student of his, over 20 years. And through my studies with him and working with my own spine, it was really the first time that I started to feel in my yoga practice that I was creating space and lengthening and opening rather than compressing. Because I always had like a little bit of pain when I practiced. And I didn't know how to enjoy a practice that was completely pain-free and also had this sense of lifting and expansion. So in this course, I'm going to go through some specific techniques and tools that really work on releasing tension in the muscles around the spine that tend to cause compression. Because if we have degenerative disc disease, which many of us or most of us do as we age, and it's a normal part of aging, I want to normalize it because this is what happens. We lose a little bit of, fluid. We do get a little shorter. Our bones,
Gravity,
change.
with gravity.
Can't change that, but what we can do is create as much space as possible with whatever we have. And so the first part is the external, the muscles that tend to compress the spine. So we work a lot on specific muscles like the paraspinal muscles, the psoas, the quadratus lumborum, different muscles that when they're tight, they actually compress the spine more. And also throughout the practice and throughout the course, we learn how to create traction and create space. So we maximize the space between each vertebrae because there isn't a lot of space in that area. And there are a lot of little nerves that come off the ends. And the only time we have pain is when nerve endings are being compressed. So we really want to decompress the nerves. We do that by creating space and optimal alignment. So that's the focus of the course, are specific tools to relax the tense muscles and to create traction within the poses, which yoga is wonderful for. And to learn how to move, the other piece that I work on a lot is how do we find the balance, the perfect balance between flexibility and stability in a pose. So some people tend to be more tight and some people tend to be overly flexible. And by the way, those people tend to have the biggest problems.
Yeah, because they need strength. They don't need to.
Exactly. And they have the most injuries. As a physical therapist, the people who are hypermobile, it's much harder to work with them and they really have to rebuild their strength. So we encourage both though. And understanding your body to know what you need. Do you need to soften into the pose? Do you need to relax, to stretch, or do you need to build more stability so you're not collapsing in the pose? So I talk a lot about that in my trainings as well.
Awesome. And there's a practice.
Yes, there's a
You're
practice.
leading a practice, which is always so helpful because you can hear the theory, but if you don't see it in a sequence, it's harder to it's just harder to visualize how am I going to put this on my own body. And this course is not just for teachers. This course is for anybody with a spine, correct?
Yeah. Which hopefully means everybody.
Probably if you don't have a spine, you're not going to take the course, but you do not have to be a teacher.
So if you have a spine, take the course. That's the bottom line. The first lecture is a lot about the structure and understanding our structure and the curves. And the second lecture, we talk a lot about mobility and understanding healthy movement. And then I put it together with a practice that's based on tools and techniques that I've used for over 28 years with my clients and have had really amazing results at any age with any results on the MRI or X-ray.
Well, it sounds awesome. And you give hope to people at any age that it's not too late to whatever your condition is. I always say this, it's never too late to make it better.
I totally agree.
And if you already have some kinds of issues that are going to be permanent, you can work on all the other structures around them. And the body is amazing, isn't it?
It is like what I often say to my students, it's all there in yoga philosophy, really. It's that I do believe the body is smart and the body is seeking balance and seeking length. And what we're doing is just removing the obstacles, really removing the tight muscles, removing the weak, strengthening the weak muscles, finding the conditions that allow the spine to be as healthy as possible. And no diagnosis is a sentence,
Yeah,
scoliosis, stenosis, I have this, I have that. A lot
yeah,
of
yeah,
people come
yeah.
to my classes. I have a funny story. I have a guy who came to my class many years ago. I taught happy back yoga classes. And he says, oh, I have 3 herniated discs, and on my MRI, I have a pinched nerve and I have sciatica, and I'm just telling you all the things that are happening. And I was like, okay, great. So let's begin, come practice. And I appreciate people telling me. And he looked at me and he says, well, you don't seem very concerned. And I said, well, everyone has what you're saying. Everyone has differentiations. That's what I've been working with for 20 whatever years. It's nothing out of the ordinary. But to each person, getting the diagnosis is very scary.
Very,
Um,
yeah,
but he appreciated that I wasn't alarmed. He also felt confident because I felt like I can work with this. It's okay.
yeah.
And he said, wow, you really, made me feel a little more normal, little more relaxed about practicing. And he ended up becoming a long-term student and
There
doing
we
great.
go. And
Mhm.
he probably got a lot better
Oh
and
yeah.
really great. Yeah.
Mhm.
Well, Rachel, this has been awesome. Thank you so much. I'm looking forward to your course and have a wonderful rest of your workshop. Where are you exactly?
I'm in San Diego, where I used to live.
Oh, but you're not
My
based there
hometown. Not based there now, no. I've
now.
moved around. But I'm teaching a workshop this week here, and I was at the symposium on yoga therapy and research in Arizona. So I'm doing a little world tour.
We'll, we'll travel. Well, good luck with your travels. Thank you for the course. I'm looking forward to it. And thank you all for your attention. We'll see you later. Bye-bye.